I want to talk to you today about something that puzzles and frustrates a great many older adults, often for years, and that seems almost contradictory. Eyes that are always dry, gritty, and irritated, or, just as commonly, eyes that water and run for no obvious reason, and sometimes, strangely, both at once. You might find your eyes feel scratchy, sandy, or burning, as if there's something in them. Or you might find them constantly watering, tears running down your cheeks at the slightest provocation, or for no reason at all, which is embarrassing and annoying. And here's the part that confuses people most. Dry eyes and watery eyes sound like opposites, yet they're very often the same underlying problem, which I'll explain. This is genuinely common as we age. It's usually not dangerous, but it's uncomfortable. It can affect your vision and your daily life, and it's very treatable once you understand what's going on. So today I want to explain how your tears actually work, why your eyes become dry or watery as you age, why those two seemingly opposite problems are so often connected, what you can do about it, and when eye symptoms are worth seeing a doctor. And I'll keep this calm and practical, because this is mostly an irritating, manageable problem rather than a frightening one. Let me start with how your tears actually work, because understanding this makes the whole dry versus watery puzzle make perfect sense, and most people have never been told. Your eyes are constantly bathed in a thin film of tears, and this isn't just water. It's a sophisticated, layered film with 3 parts. There's a watery layer that provides moisture, an oily layer on the outside that stops the watery layer from evaporating too quickly, and a mucus layer underneath that helps the tears spread evenly and stick to the eye. This tear film keeps your eyes moist, smooth, comfortable, and able to see clearly, and it washes away dust and protects against infection. Now, here's the key. For your eyes to be comfortable, you need not just enough tears, but tears of the right quality, with all 3 layers in good balance. If any part of that film is off, if you don't produce enough of the watery part, or if the oily part is deficient, so the tears evaporate too fast, the surface of your eye dries out and becomes irritated. That's dry eye. And understanding that it's about both quantity and quality of tears is the key to understanding everything else, including the watering. So let me explain why this goes wrong as we age, because dry eye is genuinely one of the most common eye complaints in older adults. As we get older, we tend to produce fewer tears, and the quality of our tears often declines, with the oily layer in particular becoming less effective, so tears evaporate too quickly. Hormonal changes with age contribute, which is part of why dry eye is especially common in older women. And a great many everyday things make it worse. Dry air, heating and air conditioning, wind, screens and reading, because we blink less when concentrating, which lets tears evaporate, and certain very common medications. So age-related dry eye, from producing fewer and poorer quality tears, is extremely common, and it's the root of most of the dry, gritty, irritated eye symptoms that older adults experience. It can cause that sandy, scratchy, burning feeling, a sensation of something in the eye, redness, tiredness of the eyes, sensitivity to light, and, importantly, blurry vision that comes and goes, and often improves when you blink, because a poor tear film blurs the surface the eye sees through. Now let me solve the puzzle of the watery eyes, because this is the part that genuinely surprises people and that explains so much. You'd think watery eyes would be the opposite of dry eyes, a problem of too many tears. But here's the counterintuitive truth. Watery, runny eyes are very often actually caused by dry eyes. Let me explain how. When the surface of your eye becomes dry and irritated, that irritation sends a signal to your tear glands that says, in effect, the eye is in distress, produce tears. So your eye responds to the dryness by suddenly flooding itself with a burst of watery reflex tears, far more than usual. But these reflex tears are mostly watery, lacking the proper balanced film, so they don't coat and soothe the eye well. Instead, they simply overflow, running down your cheeks and then drain away, leaving the eye dry again, which triggers another flood. So you get this cycle of a dry, irritated eye producing bursts of overflow tears, which is why dry eye so often shows up, paradoxically, as watery, runny eyes. This is why the same underlying problem, an unstable, poor-quality tear film, can cause either dryness or watering, or both at different times. And it's why treating the underlying dryness often resolves the watering. There's also another cause of watery eyes worth knowing. With age, the tear drainage ducts that normally carry tears away from the eye into the nose can become narrowed or blocked, so tears back up and overflow, and the eyelids can become a little lax with age, so they don't drain tears properly. So watery eyes can come from the dry eye reflex cycle or from drainage problems, both common with age, and a doctor can tell which is which. Let me talk about medications, because this is a big and often overlooked contributor to dry eye in older adults. And the same medications that cause dry mouth often cause dry eyes, for the same reasons. A great many common medications reduce tear production or worsen dryness as a side effect, including antihistamines for allergies, many medications for blood pressure, water pills, antidepressants, medications for an overactive bladder, and others, especially those with anticholinergic effects that reduce secretions. And since older adults often take several medications, the drying effects can add up. So if your eyes have become dry, one thing worth considering and discussing with your doctor or pharmacist is whether a medication might be contributing, though as always, you shouldn't stop anything on your own. This is the same theme as dry mouth. Medications are a leading, fixable cause of dryness in older adults, and recognizing that can point toward relief. So let me give you the practical ways to manage dry and watery eyes, because the good news is that there's a great deal that helps, and most people get real relief. First and most important are artificial tears, lubricating eye drops that supplement your natural tears and soothe the dryness. These are widely available without prescription, and using them regularly, not just when your eyes feel bad but routinely through the day, is the mainstay of managing dry eye, and it often resolves the watering too by addressing the underlying dryness. For frequent use, preservative-free artificial tears are gentler on the eyes. There are also thicker lubricating gels or ointments for nighttime, since eyes can dry out overnight. Second, address your environment. Use a humidifier to add moisture to dry air. Avoid having fans, heating, or air conditioning blowing directly at your face. Wear wraparound sunglasses outdoors to protect against wind and sun. And take regular breaks when reading or using screens, remembering to blink fully because we blink too little when concentrating. Third, warm compresses and gentle eyelid care can help, especially when the oily layer of the tears is the problem. A warm compress held on closed eyes helps the little oil glands in the eyelids work better, improving tear quality. And gentle cleaning of the eyelid margins helps if there's any crusting or inflammation there. Fourth, stay hydrated and consider whether your overall fluid intake is adequate. Fifth, review medications with your doctor if you suspect one is contributing. And sixth, some people benefit from dietary measures like omega-3 fats, which may help tear quality. Worth asking your doctor about. These simple measures, especially regular artificial tears and attention to the environment, relieve the great majority of dry and watery eye problems. Now let me be clear about when eye symptoms warrant seeing a doctor or eye specialist, because while most dry and watery eyes are benign and manageable, certain things deserve professional attention. See an eye doctor if your symptoms are persistent, bothersome, or not relieved by artificial tears and the simple measures, because they can assess your tear film, look for specific causes, and offer more advanced treatments, including prescription drops, treatments for the eyelid oil glands, or for blocked tear ducts, procedures to open the drainage. See a doctor promptly, and don't just treat it as ordinary dry eye. If you have eye pain, significant redness, discharge that's thick or colored suggesting infection, sudden changes in your vision, vision loss, light flashes, a curtain or shadow over your vision, or the sensation of a foreign object you can't flush out, because these can signal infections or other eye problems that need prompt care. And here's an important connection. Dry, gritty eyes occurring together with a dry mouth can sometimes be a sign of an autoimmune condition that targets the glands producing tears and saliva. So that particular combination, dry eyes and dry mouth together, is worth mentioning to your doctor. So the framework is, try artificial tears and the simple measures for ordinary dry or watery eyes. But see an eye doctor if symptoms persist or are severe. And seek prompt care for pain, significant redness, discharge, or any vision changes. Let me emphasize a point that people underestimate. Don't just live with chronically uncomfortable eyes, because it genuinely affects your life, and there's so much help available. Chronic dry eye can make reading, watching television, driving, and using screens uncomfortable and tiring. It can cause that fluctuating blurry vision that makes everything harder. And the constant grittiness or the embarrassing watering wears on people. Many older adults simply endure this for years, dabbing at watering eyes or squinting through grittiness, not realizing that regular artificial tears and a few simple measures could bring real relief, or that an eye doctor has further treatments. So please don't write off chronically uncomfortable eyes as just something to put up with. It's a common, manageable problem, and addressing it can genuinely improve your comfort and your vision day to day. Let me also connect this briefly to the importance of regular eye care in general, because it fits here. While dry and watery eyes are usually benign, the eyes are also where the serious, often silent eye conditions of aging develop. Glaucoma, macular degeneration, cataracts, and where signs of conditions like diabetes and high blood pressure can show up, as I've discussed elsewhere. So having regular comprehensive eye exams matters for far more than dry eye. And when you see an eye doctor about dryness or watering, it's also an opportunity for them to check the overall health of your eyes. So let your dry or watery eyes be one more reason to keep up regular eye care, which protects your vision and your eye health broadly. Let me paint you a picture of how this commonly plays out, because it captures the confusion and the relief. Picture a woman in her 70s whose eyes have become a daily nuisance, often gritty and burning as if there's sand in them, and yet confusingly, frequently watering and running down her cheeks. especially in wind or cold, which is embarrassing. She's baffled because dry and watery seem like opposites, and she's been told, or assumed, that watery eyes mean too many tears, so she's puzzled that they also feel dry. She's been doing nothing about it, just dabbing at them and enduring. She learns what you're learning today, that her watery eyes are very likely caused by the underlying dryness, her irritated eyes flooding with overflow reflex tears. She starts using preservative-free artificial tears regularly through the day, runs a humidifier, stops sitting in the draft of the heating vent, wears wraparound sunglasses outdoors, and uses warm compresses on her eyes. Within a couple of weeks, both the grittiness and the watering improve markedly because she's treated the root cause. And when she sees her eye doctor, who confirms dry eye and also does a full check of her eye health, she gets further advice and the reassurance that her eyes are otherwise healthy. The contradictory, frustrating problem she'd endured for years turned out to be one understandable, treatable thing. That's exactly the relief that understanding brings. And let me speak directly to those of you caring for or close to an older person, because eye discomfort is easy to overlook and easy to relieve. You might notice a loved one with red, irritated eyes, frequently watering or wiping their eyes, complaining of grittiness or burning, having trouble reading or watching television comfortably, or squinting. You can help with the simple measures, encouraging regular use of artificial tears, setting up a humidifier, adjusting the environment to avoid drafts and direct air on the face, and providing wraparound sunglasses. You can help review their medications with the doctor, since many cause dryness. You can encourage an eye doctor visit if symptoms persist or are bothersome, both for treatment and for a full check of their eye health, and prompt care for any pain, significant redness, discharge, or vision changes. And you can note the dry eyes with dry mouth combination as worth mentioning to their doctor. Helping an older person relieve chronically uncomfortable eyes improves their comfort, their vision, and their daily life from a problem that's very manageable once understood. Let me draw this all together. Dry, gritty, irritated eyes and watery, runny eyes, which sound like opposites, are very often the same underlying problem in older adults: an unstable, poor quality, or insufficient tear film. As we age, we produce fewer and poorer quality tears. The protective oily layer weakens, so tears evaporate too fast. And many common medications worsen the dryness, all leading to that gritty, burning, sometimes blurry dry eye sensation. And the watering is usually caused by the dryness itself, as the irritated eye floods with overflow reflex tears that run off without soothing it, though age-related tear drainage problems can also cause watering. The great majority of this is benign and very manageable with regular artificial tears, a humidified and draft-free environment, wraparound sunglasses, breaks and blinking during screen and reading time, warm compresses, hydration, and a medication review. But persistent or severe symptoms warrant an eye doctor who has further treatments, and eye pain, significant redness, discharge, or any vision changes warrant prompt care. While dry eyes together with a dry mouth are worth mentioning to your doctor. So here's what I'll leave you with. First, understand the puzzle. Dry eyes and watery eyes are very often the same problem: an unstable tear film, with the watering usually caused by the underlying dryness, which is why treating the dryness so often resolves both. Second, use the mainstay of relief: regular artificial tears, preferably preservative-free for frequent use, not just when your eyes bother you, but routinely through the day, along with a humidifier, avoiding drafts and direct air on your face, wraparound sunglasses outdoors, taking breaks and blinking during reading and screen time, and warm compresses on the eyes. Third, review your medications with your doctor or pharmacist if you suspect one is drying your eyes, without stopping anything on your own. Fourth, see an eye doctor if your symptoms persist or aren't relieved by the simple measures, both for further treatment and for a full check of your eye health, and seek prompt care for eye pain, significant redness, discharge, or any change in your vision. And mention the combination of dry eyes and dry mouth if you have both. And fifth, don't just endure chronically uncomfortable eyes, because it affects your comfort and vision and is very manageable. Your eyes do remarkable work for you every waking moment. A little understanding and care can keep them comfortable. So take care of yourself. Treat your dry or watery eyes with the simple measures and see an eye doctor when needed. And because only an eye doctor can properly assess your eyes and offer further treatment, and because vision changes can signal urgent problems, please treat persistent, severe, or vision-affecting eye symptoms as your reason to seek professional eye care, rather than as a substitute for it.